first like to say that I am truly honored to be here today. I'm blown away and appreciative for MAPC for considering me and thinking about me to invite as a presenter. I want to take a moment to recognize this incredible room full of individuals working tirelessly. And I'd like to say that I appreciate all the work that you're putting in, the work that is seen and the work that is unseen. Hang on. It's not gonna happen. Okay, I'm not getting the slides to move. Okay. So my name is Samantha Brown, and I want to share a piece of my story with you today to help you see why I feel so passionate about trauma-informed care. I grew up facing various forms of trauma, much like many of the individuals we meet daily. My parents divorced when I was young, and I had to switch schools and move out of state with my mom to live with a family I didn't know and didn't feel I fit in with. Over time, my mom became an alcoholic and an addict. I was raised by her and her boyfriend, who was also an alcoholic and who did not speak the same language as me. We lived in a neighborhood where poverty was the norm, and the school of hard knocks was the most education people really got. As an only child, by the age of 12, I most certainly felt alone. One of the most challenging experiences I had was being groomed at age 13 for a life of commercial sexual exploitation. An older man recognized the trauma I was experiencing, saw that I was living in survival mode, and used this to his advantage. To cope with life, I turned to substances, which quickly became a significant part of my existence and eventually the most important part, from age 13 until I got sober on May 23rd, 2019. This story, thank you. This story is not that unique, and it's not that different from the experiences of many people we meet today. Most people have faced some form of trauma in their lives, and while the specifics may vary, the pain and impact can often feel the same. My journey to sobriety was driven by a deep desire to stop using. Still, it was also made possible by finding myself in an environment that offered safety and stability, something I hadn't experienced in a long time. When I arrived at Thistle and Bee, a 2-year residential recovery program here in Memphis for women exiting commercial sexual exploitation and addiction, I realized I had never really truly trusted anyone. The staff at Thistle and Bee understood this and knew how hard it was for me to trust others. Yet they continued to show up. Their consistent presence made it possible, showing up every day, not perfectly, but as real humans. Their honesty and transparency in walking alongside me on my recovery journey made all the difference. Thistle and Bee's peer-led model offered a peer support, and I connected with others who had walked similar paths. Mutuality and collaboration were central, not only between the residents, but also between the staff and participants during programming. For the first time, I felt empowered. While I did have to follow the rules, I was given a voice and a choice in my journey, and that sense of empowerment was critical to my recovery. Thistle and Bee helped me reclaim my autonomy and encouraged me to make decisions that aligned with my goals and my journey. On this journey, I also began to understand how cultural and historical factors have suppressed so many people, often without us even realizing it. These conversations were essential to my healing process, allowing me to gain a deeper understanding of the trauma I had experienced and its broader context. Thanks to the trauma-informed care provided by Thistle and Bee, I was able to create a life I never dreamed possible. Today, I dedicate my time and efforts to providing the same trauma-informed care to other women like me, helping them find their path to recovery. The opioid epidemic is an ongoing crisis, and the risk of addiction and overdose are too real. I'm ready to give back the support I received and help others find a way to a new life. What is trauma? Trauma is a stressful or dangerous event that can have lasting negative effects on a person's physical, emotional, and social well-being. It can be caused by experiencing or witnessing physically or emotionally harmful or threatening events. When we work with individuals who have experienced trauma, it's essential to recognize the different ways trauma can manifest and how it impacts their lives. Trauma can be difficult to identify for many, including myself. At first, I thought only extreme experiences like kidnapping or rape were traumatic. However, I was shocked to learn that events like car accidents or house fires could also be classified as trauma. Some of these events I had felt were normal and part of life, but learning that they could still be traumatic helped me understand the broader scope of what trauma can look like. This highlights how unaware many people, including our clients, may be of their trauma. What may seem like everyday occurrences could be deeply impactful to someone who has had previous traumatic experiences. For me personally, learning about trauma and understanding that my own experiences were valid was incredibly empowering. This awareness allows me to give myself grace, especially during the more challenging moments in my journey. It taught me that trauma doesn't have to be the big awful stuff I once thought to have a profound impact on someone's life. As we continue our work, we must be aware of the different types of trauma. Here's a short list of some examples. I believe it's essential to highlight the concept of system-induced trauma, as many of our clients have been affected by it throughout their lives. This type of trauma stems from interactions with organized systems. Some examples would be the criminal justice system or child welfare systems. These types of trauma can be subtle, but their effects are profound and can impact a client's ability and trust to engage in care again. Our role in providing effective and trauma-informed care is vital. We must ensure we're not inadvertently re-traumatizing our clients and instead offer a space where they feel safe, heard, and empowered to heal. According to a 2019 Tennessee Department of Health report, 61.2% of adults in the state reported experiencing at least one adverse childhood experience. ACEs include various forms of childhood abuse, neglect, and household dysfunction that are linked to a higher risk of developing substance use disorders later in life. 24.1% of Tennessee adults have experienced 3 or more ACEs, which significantly increases the likelihood of addiction and mental health issues. National studies estimate that as many as 80% of women in treatment for substance use disorders have experienced trauma, with sexual abuse and domestic violence being the most common forms. Given Tennessee's high rate of human trafficking and domestic violence, these figures are likely similar or even higher in the state. The TBI has identified multiple trafficking hotspots across the state. Human trafficking survivors are highly vulnerable to developing addictions as a means of coping with the intense trauma they endure. This impacts our community. Given that Memphis is considered a human trafficking hotspot, it's more often than not that many of the individuals we serve have experienced commercial sexual exploitation in some form. The prevalence of trafficking in our city makes it an unfortunate reality for many women. as they face exploitation, violence, and the severe trauma that comes with it. This trauma often leads to substance use as a coping mechanism, creating a cycle of addiction and further victimization. Even for those who haven't been trafficked directly, the surrounding environment of exploitation and abuse can have a profound effect, compounding the challenges faced by many we serve. Tennessee remains one of the states hardest hit by the opioid epidemic. In 2022, Tennessee had an opioid prescription rate of 62.7 prescriptions per 100 persons, one of the highest in the country. The national average is 43.3 per 100 persons. In 2022, Tennessee reported more than 3,800 drug overdose deaths, with opioids involved in nearly 75% of these cases. Many of these individuals had a history of trauma, particularly childhood abuse, neglect, or domestic violence. In 2022, 20% of Tennesseans reported struggling with mental health issues, which are often linked to unresolved trauma. The prevalence of depression and anxiety is much higher among individuals with a history of trauma, which can also increase the risk of addiction. The Tennessee Department of Mental Health and Substance Abuse Services promotes trauma-informed approaches in addiction treatment. Research shows that these approaches improve treatment engagement and recovery outcomes for people with substance use disorders, emphasizing the critical link between trauma and addiction in Tennessee. This slide highlights the 6 guiding principles of a trauma-informed approach developed by SAMHSA and the CDC's Office of Public Health Preparedness and Response. These principles include safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice, and choice, and cultural, historical, and gender issues. The training emphasizes that adopting a trauma-informed approach is an ongoing process, requiring continuous attention, awareness, and a potential cultural shift at an organizational level. By integrating these principles, responders can more effectively support communities during public health emergencies. This training was the first step toward viewing emergency preparedness through a trauma-informed lens. Trauma-informed care is an approach that recognizes the widespread impact of trauma and seeks to create a safe, supportive environment by understanding, identifying, and responding to the effects of trauma. Many individuals struggling with addiction have experienced significant trauma. Focusing only on addiction without addressing the underlying trauma can perpetuate the cycle of relapse. Trauma-informed care helps individuals feel safe, empowered, and supported in their healing journey. In my recovery journey, I realized that my addiction wasn't just about substance misuse. It was deeply connected to the trauma I had experienced throughout my life. For years, I used substances as a way to cope with that pain. Programs that didn't address my trauma left me feeling stuck and unable to heal fully. I was caught in a cycle of relapse. It wasn't until I was in an environment that practiced trauma-informed care that I felt safe enough to begin healing. They didn't just focus on my addiction. They recognized the underlying trauma and created a space where I could build trust and feel empowered. This approach helped me break free from the cycle and truly recover. Trauma-informed care was essential in giving me the tools to rebuild my life and sustain my sobriety. Unresolved trauma can leave individuals in a state of emotional and psychological distress. To cope with overwhelming feelings such as fear, anxiety, or shame, many turn to substances as a way to numb the pain. Over time, this becomes a destructive cycle where addiction serves as a temporary relief, but ultimately deepens the emotional wounds. Without addressing the root trauma, individuals are more likely to experience relapse as the substance becomes their primary coping mechanism. Here are a few responses our body has to trauma. Fight response. This looks like reacting aggressively or defensively to protect oneself from perceived danger. Common signs are anger, irritability, or physical aggression. Flight response. The urge to escape or avoid the threatening situations. Common signs are anxiety, restlessness, or withdrawal from others. Next, we have freeze response. Feeling paralyzed, unable to act or make decisions in the face of trauma. Common signs are disassociation, numbness, or feeling stuck. And fawn response. Seeking to please or appease others to avoid conflict or harm. Common signs are people-pleasing, difficulty setting boundaries, or prioritizing others' needs over one's own. When we think about the impact of complex PTSD, it's essential to understand the wide range of symptoms that can manifest. First, we see difficult to regulate emotions. Individuals may experience intense emotional responses or numbness that can feel overwhelming or unpredictable. Next, we have altered attention and consciousness. This can include disassociation or feeling disconnected from the present moment and difficulties with memory or concentration. Another component is somatic distress. This means physical symptoms like chronic pain, tension, or fatigue that stem from the body holding on to trauma. We then see hyperarousal, where the individual is constantly on edge, scanning for danger and experiencing heightened reactions to stress. Avoidance of reminders and triggers is another common symptom. People with complex PTSD often go out of their way to avoid situations, places, or people that remind them of their trauma. Flashbacks and nightmares are also another key indicator. These intrusive experiences make the trauma feel as though it's happening all over again, often disrupting their daily life and sleep. Trauma can also significantly alter belief systems. Survivors might struggle with feelings of shame, guilt, or mistrust, and they may view the world as unsafe or themselves as unworthy. Lastly, we have difficulties in relationships. Complex PTSD can impact the ability to connect with others, leading to struggles with trust, intimacy, and maintaining healthy boundaries. Each of these aspects highlights the profound and multifaceted ways trauma can affect a person's life, and they remind us why trauma-informed care is so crucial in supporting individuals on their healing journey. Before we dive into solutions, it's critical to understand how trauma shapes behavior and contributes to challenges like substance use. This slide highlights some common trauma responses. For instance, craving control and agreeing to things to keep the peace often stem from a history of unsafe or unpredictable environments. These individuals might feel like they have no choice but to adapt to survive. Many live on guard all the time, hypervigilant for danger, and develop a pessimistic worldview with dwindling trust in others. This can isolate them from the supportive relationships they need. Seeking constant escapism, whether through substances, risky behavior, or distractions, this is another response as it helps numb the pain of unresolved trauma. Similarly, feeling responsible for the other's happiness or saying yes out of fear of losing security can leave people emotionally drained and vulnerable to further exploitation. Other responses include chronic feelings of emptiness, reckless impulses, and neglecting personal safety. These behaviors aren't about making bad choices. These are survival strategies learned through their trauma. When we recognize these responses, we see how trauma increases vulnerability to substance use, including opioids. This makes trauma-informed care essential, not only for healing, but for breaking cycles of addiction and fostering long-term recovery. Now that we've explored what trauma is, how it impacts the body and mind, and what trauma responses can look like, including the connection to addiction, it's time to shift our focus to the solution. Trauma-informed care starts with a foundational framework summarized in the 4 R's. Realize, recognize, respond, and resist re-traumatization. These principles guide us in creating environments and systems that are sensitive to trauma's impact while fostering healing and recovery. Let's take a closer look at what each of these R's mean and how they prepare us to support individuals more effectively. 1. Realize. Understand the widespread impact of trauma and its effects on mental, emotional, and physical health. It's crucial to recognize that trauma is present in many people's lives and this shapes their behaviors and responses. 2. Recognize. Identify the signs and symptoms of trauma in those we serve. Trauma responses like hypervigilance, disassociation, or avoidance are common coping mechanisms, and recognizing them allows us to understand the root cause behind these behaviors. 3. Respond. Implement trauma-informed practices in our interactions and interventions. This means adapting our services and support systems to be sensitive to trauma, ensuring that we offer a safe, supportive, and empowering environment for healing. And 4, resist re-traumatization. Avoid actions or practices that could inadvertently trigger or re-expose someone to past trauma. By focusing on creating safe spaces, we ensure that individuals can rebuild trust and engage in healing without fear of further harm. By following these 4 R's, we can ensure that our practices are not just about responding to trauma, but about fostering a compassionate, healing environment that supports long-term recovery. Now that we've discussed what trauma is and how it manifests, now let's look at how trauma-informed care comes to life in action. Supporting someone who has experienced trauma means adopting practices that foster healing and resilience. First, we want to provide space, a safe, non-judgmental environment where they feel secure enough to open up. Next is predictability, which means offering consistency and routine. This helps rebuild their sense of safety and stability. We also need to maintain perspective, recognizing and validating their emotions and experiences without minimizing them. Recalibration. This involves managing expectations, both for them and for ourselves. Healing is a process, and it won't happen overnight. Attribution is crucial, reminding them that the trauma is not their fault and placing responsibility where it belongs. Reciprocity. This helps us rebuild trust through mutual respect and genuine connection. This ensures the relationship isn't one-sided, but rather empowering. Providing support includes offering resources, listening without judgment, and showing empathy throughout their journey. And finally, we emphasize choice, allowing them to make decisions for themselves. Empowerment is the cornerstone for recovery. By following these principles, the individual is more likely to feel supported, respected, and empowered in their healing process. This type of care fosters resilience and long-term recovery, which is why trauma-informed care is essential in recovery from addiction. Let's explore how these principles can be practically applied. 1. Language and communication. Using non-judgmental, empathetic language that fosters trust and respect is essential. For example, instead of labeling someone as an addict or homeless, we use person-first language, like individual in recovery, or person experiencing homelessness, which helps reduce stigma and empowers the person. Similarly, instead of telling someone to snap out of it, we acknowledge their experiences by saying, I can see that you're feeling overwhelmed. Let's talk through what you're experiencing. This approach validates their emotions, reduces shame, and helps build a supportive and trusting relationship. 2, providing choice. Empowering individuals with choices can be transformative. For example, at Thistle&B, I do my best to provide opportunities for the women to make choices. It could be as simple as them coming together and deciding what meeting they all agree that they would like to go to next. This choice creates a sense of autonomy, which serves as a powerful tool in the healing process. 3, creating sensory-friendly spaces. Individuals who have experienced trauma often have heightened sensitivity to sensory stimuli. Creating sensory-friendly spaces can significantly improve their comfort and help prevent triggers. This could mean dimming lights, offering noise-reducing headphones, or creating a quiet area where individuals can take a break to calm their nerves. 4, active listening. Active listening is at the heart of trauma-informed care. It's important that we listen without interrupting or rushing. Reflecting back on what we hear helps individuals feel seen and understood, which is essential for their emotional safety. For instance, saying, I hear that you're feeling overwhelmed right now. Let's talk about what might help. Shows empathy and validation. 5, training and self-care for providers. It's crucial for providers to be trained in trauma-informed care principles. This ensures they can offer the most supportive care possible and minimize re-traumatization. Provider self-care is just as important, whether through regular debriefing sessions, mindfulness practices, or ensuring adequate time for personal rest. This helps prevent burnout, so providers can continue to be present and effective in supporting those that we serve. 6, de-escalation techniques. Individuals may experience moments of distress or agitation. De-escalation techniques such as providing space, speaking calmly, and offering grounding exercises can help prevent escalation and ensure the safety of everyone involved. Whether it's helping someone through a panic attack or calming an individual during a flashback, these techniques allow for more supportive interactions that prioritizes everyone's safety. By incorporating these principles, we can create environments that foster healing, restore dignity, and empower individuals on their recovery journey. No matter the setting, these approaches make a significant difference in supporting resilience and long-term recovery. Now that we've explored what trauma-informed care looks like in action, let's dive into the core values and principles that guide trauma-informed practice. These values and principles provide a framework for creating environments that support healing and resilience. They're not just theoretical, they're the building blocks of how we engage with the individuals we serve. We find safety, trustworthiness, choice, collaboration, and empowerment at the heart of trauma-informed practice. These core principles shape how we interact with individuals and help us build a supportive and healing environment. Safety ensures that both physical and emotional well-being are prioritized. This means creating environments where individuals feel protected and supported. Trustworthiness is about being clear, consistent, and transparent in our actions. This helps people know what to expect and builds confidence in the process. Choice empowers individuals by giving them control over decisions related to their care and their recovery. Autonomy is critical to restoring a sense of power and self-determination. Collaboration emphasizes working with the individual, rather than doing things to them or for them. It's about sharing power and acknowledging their strengths in the process of healing. Empowerment involves recognizing and fostering an individual's strengths, skills, and resilience. This is key to helping individuals build hope and see a path forward in their recovery. In practice, these principles and values manifest through concrete actions like embracing diversity and inclusion. We want to recognize the unique backgrounds, cultures, and experiences of those we serve. This allows us to meet their needs in a more personalized and respectful way. Using supportive, non-confrontational language. When giving consequences or addressing challenges, we should use non-judgmental and solution-focused language. This helps avoid triggering any feelings of shame or defensiveness. Providing clear information about expectations. One of the most important aspects of trauma-informed care is ensuring that individuals understand what is expected of them. This also ties into informed consent and ensuring they fully comprehend what they're agreeing to. Informing others of transitions ahead of time, whether it's a change in routine, a shift in care, or a transition in recovery. Giving people advance notice helps them feel prepared and reduces anxiety. Balancing flexibility while defining parameters. We need to be flexible and responsive to individuals' needs, but it's also crucial to maintain clear boundaries and expectations. This helps to strike a balance between providing autonomy and maintaining structure. Acknowledging power dynamics. As providers, we must recognize how power dynamics play out in our relationships. Acknowledging and addressing these dynamics promotes more equality and transparency in the therapeutic process. Building strengths and capacities. Instead of focusing on challenges, trauma-informed care is about recognizing and enhancing the strengths and skills of those we serve. This helps individuals build a realistic sense of hope and possibility. As we apply these values and principles, we are not just addressing the effects of trauma. We are actively creating environments that empower individuals and help them reclaim control over their own recovery journey. These values guide us in providing compassionate, trauma-informed care in all settings. Now that we've covered trauma-informed principles and values, let's look at a practical cheat sheet for applying trauma-informed care. While this cheat sheet was originally created for children, it's just as relevant for adults. The core concepts can be used to support individuals of any age. 1, we want to identify trauma triggers. Always be mindful of potential triggers. Look for abnormal behavior or reactions that may indicate trauma responses. 2, respond, don't react. Avoid reacting with heightened emotions when responding to an activated or overwhelmed person. Stay composed, lower your voice, and acknowledge their emotions. This helps them feel safe and supported, which is essential for their healing. 3, create a routine. Creating a predictable daily structure is essential. When people experience trauma, the predictability of their environment helps rebuild a sense of stability. 4, be emotionally and physically available. People who've experienced trauma may distance themselves. It's important to offer attention, comfort, and encouragement while also respecting their boundaries. Be patient as they may take time to warm up to receiving support. And 5, don't take behavior personally. Trauma can affect how people express their emotions. If someone is acting out, it's important to remember that their behavior is a reflection of their trauma, not you. Support them in expressing their emotions and reward their efforts to do so. By staying mindful of these strategies, you're offering a trauma-sensitive, supportive approach that can be incredibly healing for individuals. As we explore re-traumatization, it's important to understand the actions, policies, and systems that can harm or undermine the healing process for individuals who have experienced trauma. These factors can perpetuate harm and hinder recovery, making it essential to recognize them in order to avoid further damage. Re-traumatization occurs in two primary ways: systemically and interpersonally. Systemic re-traumatization is rooted in structures and policies that perpetuate harm, such as institutional racism and oppressive systems. Relational re-traumatization happens within interpersonal interactions, where power dynamics, interpersonal racism, and coercive practices undermine trust and safety. Both forms of harm can have significant and long-lasting effects on people who have experienced trauma. Key contributors to re-traumatization: 1. Systemic policies and procedures. Rigid systems that overlook individuals' needs can hinder the healing process. For marginalized groups, structural and institutional racism often amplifies trauma, further undermining their sense of safety and support. 2. Having to retell their story. Continuously asking individuals to retell their traumatic experiences can re-traumatize them. This forces them to relive their trauma, which worsens their emotional state and erodes trust in the helping system. 3. Being treated as a number. Treating individuals as faceless numbers instead of recognizing them as people dehumanizes them. This prevents the development of trust, which is essential for healing. 4. No choice in service or treatment. Denying individuals a say in their treatment or services strips them of autonomy. This lack of control sends a message that their preferences and needs are irrelevant. 5. Non-acknowledgement of work-related stress. Ignoring the stress clients experience, especially when they are juggling multiple challenges, creates an environment where they feel unseen and unsupported. This leads to disengagement and increased anxiety. 6. Inadequate accessibility measures. Practices that overlook physical, emotional, or cognitive accessibility needs can further alienate individuals. Accessibility extends beyond physical accommodations to include addressing emotional and mental well-being. 7. Isolation and exclusion practices. Isolation from groups or communities or exclusion in treatment settings is a huge trigger for people with trauma histories. This exasperates feelings of abandonment and alienation. 8. Marginalizing practices, cultural insensitivity, and isms. Disrespecting someone's cultural background or identity is harmful and creates a barrier to healing. Cultural insensitivity and isms like racism or sexism perpetuate oppression and feelings of worthlessness. 9. Power dynamics and lack of collaboration. When clients are treated as if they have no voice in their treatment, or when their experiences are ignored, it undermines collaboration and trust. Non-collaborative approaches reinforce feelings of helplessness and disempowerment. 10. Coercive or punitive practices. Using punitive measures or coercive practices in place of supportive methods can escalate trauma. This approach strips away decision-making power, reinforcing feelings of powerlessness and distress. 11. Non-inclusive language. Using language that excludes or marginalizes people, whether based on gender, race, or other identities can cause emotional harm. Inclusive language helps individuals feel respected, heard, and validated. 12, victim blaming and microaggressions. Victim blaming makes individuals feel responsible for their trauma, hindering recovery. Microaggressions, which are subtle dismissals of someone's experience, can cause deep emotional harm and undermine safety. 13, non-transparency and veiled truths. Lack of transparency regarding treatment plans or decisions breeds confusion and distrust. When individuals feel misled or manipulated, it directly harms their sense of safety. All of these principles are things we must actively avoid in order to truly support healing and recovery. The key to trauma-informed care is to provide safety, trust, and respect, and these harmful behaviors completely undermine those core principles. To close, I'd like to share a helpful cheat sheet from Bessel van der Kolk's work, The Body Keeps the Score. This summary covers essential concepts regarding the effects of trauma on the brain and body, highlighting areas such as disassociation and detachment, the importance of safety in the healing process, and the therapeutic approaches that can guide recovery. It also emphasizes the role of relationships, mindfulness, narrative, resilience, and recovery, all of which play a crucial part in trauma-informed care. The concepts you see here are critical for understanding and applying trauma-informed practices in a meaningful way. By incorporating these strategies, we can better support individuals in their healing journey. As I wrap up my portion of today's presentation, I want to acknowledge the incredible work each of you are doing in this field. It is not easy, but the impact we have on individuals who have experienced trauma is immense. By creating environments that prioritize safety, trust, and empowerment, we facilitate healing and help individuals reclaim their autonomy and sense of self. As we continue our journey in this work, I encourage you to reflect on the principles of trauma-informed care that we discussed today and consider how they can be further integrated into your practices. Remember, trauma-informed care isn't just about changing systems. It's about transforming the way we relate to and support individuals. I'll leave you with this thought from Bessel van der Kolk. We are all wounded in one way or another, and healing is an ongoing process that involves a mix of acceptance, learning, and growth. This is a reminder that healing is a continuous journey for the individuals receiving care and the caregivers themselves. Thank you for your time and commitment to this critical work. I now look forward to hearing from my colleagues who will continue to expand on these important topics today. But before I pass it over, I'd be remiss if I didn't take a moment to speak about something that is close to my heart, and that's commercial sexual exploitation. It is impossible for me to stand in front of you today without acknowledging the seriousness of trafficking, especially here in Memphis. This issue impacts so many lives in our community, and it's vital that we recognize how real it is. If you know anyone who is experiencing any form of commercial sexual exploitation, please reach out. There is help. At Thistle & Bee, we offer a 2-year residential program providing holistic care for individuals who have experienced commercial sexual exploitation coupled with addiction. This program offers healing and support as they reclaim their lives. Commercial sexual exploitation is any situation where someone is coerced or manipulated into engaging in sexual acts for money, goods, or survival, often under pressure or fraud. It's important that we recognize this is in our community and know where to turn for help. Thank you again for your commitment to this vital work. I'm happy to connect with anyone who has questions or wants to learn more about the resources we provide.